Good afternoon, everyone. It's been ages since I've hosted a webinar, so it's great to be back with you all, and I appreciate you being here with us today. My name is Derek Coy, and I'm a Senior Program Officer here at the New York Health Foundation. Joining me in conversation to discuss new insights on veterans' health in New York State is my illustrious colleague, Mary Ford, the Foundation's Director of Policy and Research. Mary, thanks for joining today.
Great to be here and really excited to talk about some of these findings in context.
Yeah, same here. I'm excited to dive into our conversation. But before we get things kicked off, a few housekeeping notes for our hearing impaired attendees like myself or anyone else in need of live stream captioning. You can click on the closed caption icon at the bottom of your Zoom screen and select the show subtitles and or full transcript options there. We don't have too much time today, but feel free to send some comments and questions into the chat during the conversation and share any contact info or resources you like there as well. We'd love to hear from you, and I will try to sneak in any questions that I can. And lastly, just a heads up, this webinar is being recorded, and we'll be sure to send out an event recap email with a link to the video that will be sent to everyone in the next few days. So be sure to keep an eye out for that. Without further ado, Mary, can you give us a brief overview of some of the veterans research you've worked on here at the foundation recently?
Absolutely. So the foundation has made it a priority as part of our veterans health work to both internally publish data as well as commission data with partners um, externally. The veterans research here at the foundation really preceded my time here at the foundation. We have been publishing data. Our first, which I think my colleague's going to drop a few of these links into the chat for us, was about 14 years ago. We partnered with the RAND Corporation to do a statewide needs assessment of health outcomes, risk factors, health utilization for recently separated veterans in New York State. We repeated this survey about a year and a half ago, which is the link that should be appearing soon. So that was really some of the formative research for our veterans health work at the foundation. Since then, annually, we have been publishing data on statewide veteran suicide trends. And about a year and a half ago, published the first of what will be many more city-specific, so New York City-specific data on suicide and deaths of despair. And then we've also published data again about a year and a half ago, but we plan to publish again descriptive data on the state's veterans treatment courts. These are, again, some of the only descriptive data that we have, looking at number of participants, demographic information, participation by court. And again, I do want to emphasize that these are some of the only data that are currently available on these programs, and definitely encourage you to check those out as they again appear in the chat.
Yeah, absolutely. Thank you for that overview. I always tell folks I'm very fortunate to have you on the team for the foundation in general, but also because I feel like I hog you a lot. You do a lot of veteran specific work, so always appreciative of that. A lot that you mentioned, would love to like do a deep dive, but since we're a little limited on time, if we can, I'd like to focus more on the suicide snapshot you mentioned. What do the numbers tell us, or what can we glean from the most recent numbers to date?
Yeah, absolutely. I'm glad you brought that up. So the data that we capture in this snapshot that's already in the or maybe shortly coming in the link. We publish these data annually. We receive the data from the annual VA report that they put out both on national and state suicide. We published this from the data that were released by the VA in early 2026 for suicide data in 2023. And I will just say that again, because we'll, I think, talk a little bit more about this, but released in 2026 for suicide data in 2023. What we saw in New York was unfortunately a spike in the veteran suicide rate, about a 25% spike that brought the rate to about 24.9 per 100,000 veterans, which again, for comparison, is about twice as high as civilians, which is about 10.7 per 100,000. Prior to 2023, the suicide rate among veterans and civilians in New York State has been pretty stable. There have been some few declines, a few increases, but really stable, which makes this kind of spike all that much concerning. The data also show that the suicide rate among the youngest age group of veterans, so that's vets 18 to 34, has more than doubled in the past decade from 23.6 to 42.2 per 100,000. So significantly higher than the average among veterans and steadily increasing over the past decade. One other thing that I will point out about these data is the overall number of suicides between 2022 and 2023. The difference that accounted for that 25% spike was a number of 27 suicides. They rose from 140 to 167. I'm pointing that out just because a little bit of the numbers behind the rates. And New York State currently ranks 45 out of 49 states for the lowest veteran suicide rankings. So that is good, but our trend is, at least based on this one most recent year of data, moving in the wrong direction. The national picture is a little bit mixed. The U.S. So overall, the suicide rate nationally had a small increase, like 1%. So kind of not, say, trend-wise, nothing I think we would look at too deeply. There were some neighboring states that saw declines. New Jersey, for example, saw about a 23% decline, giving New Jersey actually the lowest rate in the country. In California, which New York kind of often compares itself to, also saw a decline. Pennsylvania, another neighboring state, saw an increase as well of about 20%. So again, it's kind of mixed, and again, a concerning data point that we definitely want to look out for. And I think one of the things to flag too is that these data just aren't that recent. So it's still a question mark now what's happened the last 2 years.
Yeah, absolutely. And we got a question from Eva. If I'm not mistaken, I believe that the national numbers are able to break down between combat and non-combat. Statewide, I don't believe we have that. And definitely something, Mary, and you and I have definitely talked about, what we'd like to have. And unfortunately, on the state level, we don't have that. Unfortunately, the one thing, when we put this out, a lot of folks had reached out and asked, okay, we see this spike. What can we attribute it to? And that really is the $1 million question. And I've been pointing folks because we don't know. I've been pointing folks to this idea of wicked problems, which is a term dubbed by German theorists Horst Rittel and Melvin Weber in the early 70s. And what it means basically is it's so complex that we can't say what one thing is causing them or what is one thing that could prevent suicide. But what we've been able to do is look at a lot of the risk factors. So, for instance, to start, we know financial instability and other factors like homelessness and justice involvement are some of the largest contributors to increasing suicide risk. We also know that online sports gambling was legalized in New York in 2022, and it quickly became the largest market in the country. And there was a study from researchers at UCLA, and it looked at associations, associated harm linked to gambling. And for example, financial stress and debt spirals, family and relationship disruption, increases in money spent on alcohol, links to criminal activity, and then finally links to suicide. So that's one thing that I've been looking at. Again, we can't say that this has had a direct causation. There seems to at least be a correlation between the two. And so I can't help but to think of that. And also sports gambling, the evidence suggests that it targets younger men in particular, those under 45, which, Mary, as you mentioned, that's where we see the highest rates in veteran suicide, especially in New York State. So that's something we've been tracking. Like, and I'm trying to be mindful of, the limitations of that speculation. But similarly, Eva, to your point, how can we, break these numbers down in a more granular way? And when we are able to look at rates on the national level, for instance, we can look at veterans with opioid use disorder, veterans with schizophrenia, homeless veterans, a lot of different ways. And one that was really alarming when you look at the rates of suicide per 100,000. Veterans with cannabis use disorder is one of the highest, and that's coming in at 125 per 100,000. So orders of magnitude larger than the general population rate in New York State. So again, it'd be great to say, hey, we think that this one thing did it. It's hard to say, but those are the two things that I've been tracking. If other folks have any thoughts or insight, would love to learn more. And I guess to harp on that one thing, Mary, we're speculating because the data we're analyzing at this point is 3 years old, like you mentioned, and it's even harder to say looking back retroactively. But sticking with the data issues, timeliness is one of the biggest. Why does it take so long to get these numbers in general?
Yeah, absolutely. So I will say that the delay in these death data um, is not specific to veterans. I think in some cases, because these are a population-specific data release from the VA, they do take longer than some other vital statistics data. But for most of the vital stats data, it is about a 2-year lag.
Mhm.
The thing I will talk about a little bit is something that hamstrings us, I would say, a little bit more in New York State, specifically with the veterans data. The state level publications that we're publishing rely on the release of these federal data, again, from the VA. They were seriously delayed this year. We usually expect them kind of early fall. This year it was the next winter, spring almost,
Mhm.
before they were released. But the federal data get those data from the states. So it's the states send those up to the feds who do what they do and then release those at the state level. There's definitely a way that our state and city could report on these without such a significant delay. And that is something that we would kind of encourage folks to think about is the opportunity to, not necessarily rely on these federal publications, but have the city or state release some of these earlier. Now, will that be, so much kind of more timely? Probably not, but it would at least give us a head start. And I think particularly in this moment of time where there have been some serious delays and disruptions in federal data releases, to really consider state and city level options to make sure those data are coming out as quickly as possible.
Yeah, appreciate that. And it's like good to know, but it's not like good news. But at least we kind of know where some of these choke points are. And you got some good insight from our audience. And this is kind of the question I've been asking folks, and Mary, I'll pose it to you. It would be really helpful to know: are we talking about combat vets, non-combat vets? Are there any kind of diagnosed cases of moral injury? Could we go strictly to a medical examiner, coroner's office? Those are all the things we're thinking of. But to ask you specifically, like how granular can these numbers get, at least on the state level, and what's in the realm of possibility?
Great. So right now, one of the other issues I think facing veterans is because the suicide data and veterans data, frankly, in particular, are dealing with smaller numbers. There seems to be a reticence among kind of government agencies to publish things that are particularly granular. There are definitely disaggregations by age, even disaggregations by sex and gender can be quite limited. And one thing, just to kind of harp back on the suicide snapshot, we saw the really alarming trend for the 18 to 34 cohort, but we don't have any ability to see within that age group, which is what, 15 years, to see if there's anything more specific. We also don't know how recently separated perhaps veterans are within that cohort. So we're really missing a lot of important information that could help inform um, strategies, again, just more effective targeting for some of these populations. The national data have a much greater opportunity to do some of these disaggregations and present data because they have larger sample sizes and because they can take those large sample sizes and survey some of those veterans and their families to get more information on those veterans, which is something that unfortunately just is not done in a way that is able to be presented at the state level, but is a model that the state or city could use to gather more information.
Yeah, I appreciate that. One thing in particular that I've been focused on, I think a lot of other folks, especially in the audience and in the space, have looking specifically at suicide for women veterans. So we know women veterans are the fastest growing demographic in the veteran community. They're also the fastest growing demographic of the incarcerated population. And we know that Justice of All veterans have one of the highest rates of suicide. But because it's like one of those weird, like, I won't say like good problems, but the number is so low that I think there's some privacy issues about releasing. So it just says under 10, I believe. So we don't know if it's 1 or 9, and then we don't know modality, things like that. Mary, so what prevents us from actually having better numbers about women veteran suicides? And is there a way that we could at least like ballpark some of these rates in lieu of more granular numbers?
Absolutely. So, I think talking about the growing numbers is something that is really important to understand and I think kind of advocate for the inclusion of more women-specific statistics in veterans research. Specifically for women, again, looking at suicide as an example, the numbers often are under 10. So those data are suppressed from the annual snapshots that we get from the feds. Um, it's a little wonky, but kind of coming from an epidemiology background where I looked a lot at kind of rare diseases where there just weren't that many cases, there are some options and I think things that we could think about to kind of deal with this small numbers problem, as we kind of call it in the research um, area. And I think maybe before a kind of quick note on the methodology is that veteran status is a known factor. This isn't something like a rare disease where you may have unknown cases walking around because they haven't been tested. We have very good records of veteran status and we have very good records of vital statistics. Now, how effectively they get matched is a different question. But again, these are known things. So this is not something out of the realm of possibility to get better data on. So, sort of to that end, even if we have small numbers, again, in the case of women's veterans, that doesn't negate the sort of validity of that data. There's definitely a privacy concern, but
Mhm.
I think sometimes the privacy concern can get conflated with the idea that the small numbers are kind of quote unquote unstable. And they're two different issues and they're not the same issue. So even if there are, for example, let's say no women veteran suicides in a year, that is the rate. The rate is just zero for that year. It's not an unstable number, it's just a small number. Similarly, if there were five um, counts in a year, that is the number. So even though it's a small number, it would be a small rate. It is very much valid. So I think we do need to kind of remind folks sometimes that small numbers, kind of rare events, don't mean unstable numbers. The kind of denominator data that we're talking about, just to get a little wonky here, for veterans is large enough to be considered stable. So I think there's really no concern there. And then just from a data practice standpoint, there are definitely ways to get around this. We could publish rate data. I think some people might be on the fence about can you kind of back calculate rate data to account, maybe. And then also solutions like aggregating years. So they could publish 2 year averages for women veterans, 3 years averages, and sort of, again, to that end, figure out kind of groupings that would get us to numbers where we could further disaggregate women veterans. It would be really helpful to know the age cohorts for women veterans who are dying by suicide. We know that number as a percentage of veterans is growing. We know the percentage of younger veterans dying by suicide is higher. What proportion of those are women? And unfortunately, that's just a data point at this moment in time that we don't have, but there are certainly some kind of, data presentation solutions that could get us at least some of those answers. So yeah, again, kind of encouraging folks to think about how we might be able to kind of advocate for data that would at least get us closer to some of these answers.
Yeah, well, I'm definitely here for the wonkiness, and I appreciate the insight and the breakdown. Find that very helpful. I'm sure folks in the audience do as well. Michael Matthews brings up a point about a recent bill passed in the New York City Council. Before we get to like a smaller focus statewide, is there anything done recently that would enhance some of this data collection or help folks in the space better understand, the larger issue of veteran suicide throughout the state?
Absolutely. So I think someone just popped this in the chat, and as one of my favorite policy things to talk about is I think that is right, the legislation's in 2019. The bill was signed into law in 2021, and in 2024, the first report was supposed to be published. We're now end of April 2026. There's sort of neither been hide nor hair of that report, but it was essentially to partner with coroners and county medical examiners to get better data on veteran deaths and specifically deaths by suicide, and that those would then be reported both in a more timely way with more information to the state health department, who would be responsible for publishing um, this report. I think from a policy perspective, this is kind of an interesting one because policy without enforcement really isn't policy at all.
Hmm.
So I think, a lot of folks kind of in the advocacy space, we think it's our jobs to get the bill, you know, passed through the different houses, signed into law, and then we did it. It's great. But there actually is a really important step after laws get enacted is to hold government officials and government agencies accountable to actually doing the work that is behind this law. This is a really good example of that very thing. We've tried, episodically to get in touch with folks who might be involved in this work at the state level and have not made, I think, a ton of kind of progress or inroads. I will say, just for kind of data access, there are data um, available at the county level for veteran suicides in what's called the New York State Health Connector dashboard. I can try to find a link to that, or maybe we'll send that link out after the webinar. So some of the data that would be required in this report are available, but I personally think they're kind of hidden in such a way that I wouldn't consider them accessible. And they're
Hmm.
certainly not presented in a report. They're not disaggregated by age, by sex. They are presented by county, but this really, really falls short of the actual bill and legislation itself. And it's one of those things that's in some ways good news that this is something that has been on policymakers' radar. But again, without this kind of enforcement and follow up, um, the bill's not doing us a lot of good yet.
Yeah, yeah, sadly, love the intention. I would love to see, some action follow as well. We're looking at the state, kind of view. If we were to narrow the aperture a little bit, can you tell us about the New York City Council bill and kind of same thing there? Like, what's the intention and how do you feel about that making a change on some of these issues?
Absolutely. So the city council recently enacted legislation that would require annual suicide reporting, and specifically disaggregation by veteran status. The kind of interesting thing about this from the bill itself looks like veteran status is essentially a disaggregator of suicide. So suicide by borough, suicide by sex, by veteran status. So it doesn't look like, at least from what I could read initially, that it would be further disaggregated by veteran, among veterans. What are the ages of veterans? Dying by suicide, what are the genders, so I think again from a visibility standpoint this would be a great step in the right direction, but I think for the knowledge specific to the veteran population may fall short of delivering on those data. Again, I think overall a promising step towards visibility of this issue, but we certainly would encourage more veteran population specific data to be required to be part of this reporting.
Yeah, I appreciate that. And Angel, in the audience asked if VA and Department of War are, in on these suicide prevention efforts. I think there's a lot to unpack there, but I would say that at the very least, VA says that it's one of their top clinical priorities. Same with Department of War. Again, I think we could discuss that a lot further, but at the very least, they are acknowledging it, and there are efforts. I wouldn't say I feel confident they're doing everything they can. But again, different story. Maybe time for a different time when we have some more leeway to
Part two.
discuss this exactly. But since we are kind of running a little low on time now, just to kind of kick it over to the lightning round. I know a lot of this is very bleak. Seeing the spike, incredibly disheartening for myself. Someone who's lost far too many friends that I served with to suicide, and it's such a personal issue. But is there anything that gives you hope? Anything that gives you hope about maybe addressing these issues?
Well, I think both of the bills that we just mentioned here, both at the state and city level, again, while not enacted or being enforced currently, they are bringing visibility to the issue. And I think, again, while there could be certainly more done also at this federal level, there's an old kind of adage in kind of management research of like what gets measured gets managed. And I think that is something true here. So I am optimistic that the veteran population will stay visible. They'll stay visible in data and reports. And because of visibility, I'm optimistic that this will at least enable advocates, you know, everybody on this call to, more effectively do their work and more effectively advocate for what veterans need.
Yeah, kind of similar if you were to get a magic wand and make data on veterans more accurate and accessible, what would you do?
Again, I think the tough thing with the data is that it really does rely on in New York State's both state and city specific partnerships and reliance on those data. Vital stats data are not something that, the public could get. We could do a DUA and get all of the access to that. I will say we've had a lot of good success working with the city vital stats folks. So if anyone's on there on this call, great shout out to them. They have facilitated really easy kind of data transfers, data collections of some of the aggregated suicide and deaths of despair data. So I think partnering and continuing those relationships with city agencies and encouraging the city and state agencies to be kind of amenable to these data requests and data sharing will be really helpful and instrumental to try to get the, again, most specific and most timely data that we can.
Absolutely. And last question for you. If our audience can leave today taking one thing with them, what should it be?
I think it's that there's a lot of people who are really interested and committed to this work. Um, I'll be honest, when I started here at the foundation, I knew very little about the kind of veterans health space, the veterans health data and research. I have gotten really passionate about it during my time here and have met a lot of just really committed individuals and organizations along the way. So, I think a lot of us are here for kind of the long term, the long haul on this work and kind of one day at a time. But a lot of folks are, really committed to making progress in these areas.
Yeah, well, Mary, can't thank you enough for the work that you do, of course, for your time today chatting with us. Also like to thank our amazing audience for joining. Would love to stay in touch. So, folks, if you have questions, if you have some answers for us, which I'm sure a lot of you all do, please be sure to hit us up and then stay in touch. Join our newsletter. Would love to see you in the future. So, thank you all and enjoy the rest of your day.